Alright, this is part 2 of the lower body. It's the girdle, the hip girdle or the lower girdle, and the leg and foot bones. Alright, last time we went over the sacrum and the coccyx, and the hip bone, as I call it. Alright, this time we're going to be going over the femur, the tibia, the fibula, and the kneecap. And we may get to the foot, but I may put that in the next video, as I said previously. Alright, so let's get right into it. The femur, one of the, the longest bone in the body, one of the biggest bones in the body. Alright, for this part, for the hip, for the femur, we're going to start at the top end. Now, hopefully you understand that this part is the lower end, so this attaches to your knee, this is your kneecap, this is the back of it, and this is the front of it, and then this part attaches to the hip as I showed on the previous video. Okay, this ball part attaches to your hip. So this is all superior, this is inferior. And another thing you should note is the which way the bone is. This is a right femur. This goes on your right side. And how you can tell is that this is the front of the knee. This round parts are on the back, not the front. You don't have two bumps on the front of your knee, hopefully. You have them on the back. Although you probably might not have noticed them as much. Alright, so this attaches to the right side of your body. Alright? And I'll try to keep this fairly in camera view. Alright, so the first thing we need to know about the femur is the femoral head. Most things that sound female-ish, femoral, is going to be referring to something along this bone or in this general area. So we got the femoral head, which is this ball right here, the part that attaches to the hip, the acetobellum. So the femoral head sits in the acetobellum, as we remember. Alright, and on this head is this little notch right here on the top. This is the fovea for ligament head. This is where the ligaments attach, alright, or sit. So the fovea is on the head of the femur. So the femoral head, fovea. A lot of F words. None of the bad ones though. Fovea, femoral head. And attached to the femoral head, anything that has a head usually has a neck. So we got the neck goes around the, attaches the bone to the femoral head. Alright, next we're going to go to the trochanters, and we had something like this on one of the arm bones, okay? If you watched my previous video. Another T word. Greater trochanter and lesser trochanter. The cool thing about this bone is, I'm going to stop wobbling all over the place, is that its greater and lesser is very, hopefully, obvious, because the greater one is much bigger and is closer to the femoral head, whereas the lesser one is further down and it's much smaller. Alright? So greater trochanter, lesser trochanter. Alright? Greater, lesser. Alright? Alright, I'm going to go down to the linea aspera. Now the linea aspera is the lines that kind of head down this. Alright? The lines that head down the middle of your femur. Again, it should be the only thing labeled in here. Linea aspera. There's a medial lip and a lateral lip, which, as long as you remember which side the head on, whichever one's on the same size as the head is the medial, whichever is on the opposite is the lateral. So medial, lateral, these are linea aspera. Linea as in lines. Linea aspera. Okay? One more thing, the list is kind of out of order, so I have to make sure I get them right. We have the lateral and medial epicondyles, which are these wonderful bumps that I was talking about earlier. We have the medial one, again, on the same side as the head. So the medial epicondyle, lateral epicondyle, okay? Medial, lateral, alright? And if we flip that over, you can kind of see them in the back here. Medial. This is the lateral. Sorry, lateral. Not the same side as the head. Medial. Same side as the head. All right. And we have this thing I'm going to note just for now. The intercondylar fossa, which is right here. I don't remember that being on our list, but it does come up again later on another bone, which is I'm sorry, I'm losing my words for a second. The intercondylar fossa, which emanates onto the next bone. There, let's say that. All right. But before we get to that, let's note one little bone. In this case, some is bigger, some is smaller. The patella. Now the patella is this little bone right here. There's no features that we have to note on it, but it's kind of like heart-shaped, only without the heart, the break in the middle here. And cool thing about bones like this, bones that look like they could be pointing at something with sharp points, and a lot of structures in the body, oddly, always point down. So don't put your kneecap like that. Excuse me. If you're trying to coordinate bones with the structures with the other bones in the body, make sure that when you attach the femur and the tibia, you have the kneecap pointing down like an arrow pointing down towards your foot. Alright? Again, that's like a lot of structures in the body, and we'll probably come up again. Especially with this next bone, the tibia. The tibia kind of, if you were to cut off this top part, looks like it's pointing down as well. Alright? So, another way you can tell this is the top. It's pointing down. If you have it like this, and you think this attaches to your foot, you have a very odd tibia. Alright? Alright, so this is the tibia. Now, I'm going to lay this next to the fibula. Just as, depending on how your humor is, is in anatomy and stuff, if it helps you remember. It does actually help me remember. One of the things I like to do is make jokes about certain bones, right? So we have the tibia and the fibula, and this is actually something I was told by my anatomy teacher in high school. This is the tibia, this is the fibula, not the tibula and the fibia. If you say that, you go to hell, alright? So tibia, fibula. Don't reverse those. Okay? And one of the things I mentioned on the previous, the femur, is the intercondylar fossa. And if you remember me noting that a minute ago, then I'm going to talk about why I did that as soon as I flip my page to the right page. Alright, there we go. The intercondylar eminence is what it's called. We have the intercondylar fossa in between here, and we have the epicondyles. They kind of sit in the intercondylar eminence. I think I have the wrong bone for the lower bone. Alright? And I probably should look up what type of bone. No, I have the right one, okay. So, this is the right femur, this is the right tibia. Alright? And they fit together like that. So this is the intercondylar eminence. It emanates from the other bone, okay? And we have the lateral intercondyle tubercle and the medial intercondylar tubercle. Now, something to remember about the tibia. I often get confused, as you might have just seen, with which way is lateral, which way is medial. This wonderful point stylus type thing on the bottom of the bone is always to the medial of the body. Alright? So anything on this side of the bone is going to be medial, alright? Another thing you want to be careful of is not having the bone backwards. Alright? You want to have the arrow part facing you, whereas the back part doesn't really have any arrow that I can tell. Okay? So if that's medial, then this part is the medial intercondyle tubercle, another T word, tubercle. This is the lateral intercondyle tubercle. Okay? Alright. Malleoli. The malleoli. Alright, so that's what this is. We have two of them. This one, but they're on different bones. Okay, so one of them's on this. Remember I said this is medial, so this is the medial malleoli. There's another one on the fibula that I'll point to in a minute. So medial malleoli, remember that that's on the inside, or malleolus, however you say it, malleolus. Medial malleolus. And now we have the fibula, which I'll place this right here. The fibula goes on this side. Alright, and I will say it right now just so I don't have to get back to it later. Whatever ends you have down here, hopefully you have the right one. This is the lateral malleolus, okay? So, medial malleolus, lateral malleolus. And as you can see, this bone kind of sits in this groove right here. Alright? And it should also attach up here a little. Okay? Right there. How to have this bone upright is one end kind of looks more flat and the other end kind of looks more like a head. The head part goes superior, okay? I don't have any other special way to remember that, so hopefully that works. Alright, so we have the tibia, the fibula, and we have the medial malleus and the lateral malleolus, okay? I am trying to find one thing in my notes that I apparently missed. It's a fibular styloid. Aha! Fibular styloid, I believe, is right there. I may be wrong on that one. Alright, another point on the body. Fibular styloid. Okay. And yeah, I'm going to cut off the video here. Part 3 will have the foot and all its wonders, and maybe the silent part of this video. Okay?